Brain tumor is a deadly disease. Majority of patients die within 9 to 12 months and less than 3% survive for more than 3 years. No one knows what causes brain tumors, but there are a few known risk factors that have been established by research. However, many medical researchers and practitioners have developed some methods to treat this illness. In today's video of Health Mantra, we'll talk about this very serious issue and we'll tell you the ways to deal with this condition. Let us begin with understanding what exactly is brain tumor. Brain tumor is an abnormal or uncontrolled growth of cells in the brain. In a healthy human body, normal cells grow old and die and new cells take their place. But sometimes this process goes wrong and some unnecessary new cells are produced when the body does not need them, while the old or damaged cells don't die as they should. The formation of these extra cells often forms a mass of tissues called a tumor. Brain tumors can be malignant or cancerous and benign or non-cancerous. When benign or malignant tumors grow, they can cause the pressure inside our skull to increase. This can cause brain damage, which can be life-threatening. Brain tumors are categorized as primary or secondary. A primary brain tumors originates in our brain. Many primary brain tumors are benign. A secondary brain tumor, also known as metastatic brain tumor, occurs when cancer cells spread to our brain from another organ such as lung or breast. What are the symptoms of brain tumor? Each part of our brain controls a particular function. When a tumor forms in a specific area of the brain, it affects the functioning associated with that part of the body. Let us make it more simple for you to understand. So, if a tumor is formed at the brainstem, it will lead to problems like lack of coordination while walking, double vision, difficulty in swallowing, speaking and closing eye. When the cancerous cell forms at cerebellum, it induces problems like involuntary movement of the eyes, vomiting and stiffness of the neck. While tumor at the temporal lobe may cause speech difficulties, memory problem, strange sensations like fear, blackouts and strange smells. If the cancerous cells reaches the occipital lobe, it will cause loss of vision on one side of the eye. At the parietal lobe, tumor cells may create problems with reading, writing or simple calculations, difficulty in navigating, weakness in one side of the body, along with difficulty in understanding words. At the frontal lobe, the tumor may cause unsteadiness and weakness on one side of the body, changes in personality and loss of smell. What causes these tumors to erupt inside our brain? Well, there is no specific cause of brain tumor. Mutation of certain genes is thought to be the main cause of some type of tumor. The role of radiation caused by gadgets like mobile phones in causing various types of cancers, including brain tumor, is still being debated. However, this fact has not been proven yet. Like other tumors, brain tumor are not infectious and can't be passed to other people. How are brain tumors diagnosed? To diagnose a brain tumor, the doctor will ask questions about symptoms along with a personal and family health history. Then, a neurological examination will be performed. In case of a slightest indication of brain tumor, the doctor may request tests like imaging studies such as CT scan or MRI to see detailed images of the brain. He may also ask to get angiogram done, which involve the use of dye and X-rays of blood vessels in the brain to look for signs of a tumor or abnormal blood vessels. Apart from this, the doctor may also ask for a biopsy to determine whether or not the tumor is cancer. What is the treatment? Surgery to remove the tumor is typically the first option once a brain tumor has been diagnosed. However, some tumors can't be surgically removed because of their location in the brain. In those cases, chemotherapy and radiation therapy may be the options for killing and shrinking the tumor. Sometimes chemo or radiation is also used after surgery to kill any remaining cancer cells. After this, the patient will require physical therapy, occupational therapy and speech therapy for a complete recovery. For someone to be diagnosed of a brain tumor can be overwhelming and frightening. However, it is important to have open and honest conversation with your doctor to express your feelings, preferences and concerns. The medical team has special skills and experience and knowledge to support patients and their families and is there to help. For more interesting videos like this, please subscribe to our channel Health Mantra.